Hi there. In today's video, we're going to talk about the joints of the human body. There are various types of joints around the body, allowing for various degrees of movement. There are three major types of joints: the fibrous, the cartilaginous, and the synovial joints. And then, the amount of movement permitted can be described as synarthrosis, amphiarthrosis, and diarthrosis. Synarthrosis are immovable joints, amphiarthrosis are slightly movable joints, and diarthrosis are freely movable joints. So let's start with fibrous joints. Fibrous joints are fixed joints formed by fibrous tissue connecting bones. There is no joint cavity and they are classified as synarthrotic joints. Example includes sutures, which are immovable joints of the cranium. At birth, they are slightly mobile due to the presence of fontanelles, which are connective tissues between the bones. And these fontanelles allows the head to pass through the birth canal during birth. And as the head develops, the fontanelles close, and the bones eventually fuse via the intramembranous ossification. Again, we have the Gomphoses, which are immobile joints between the teeth and the sockets in which they are embedded. We also have the Syndesmosis, which are slightly movable joints owing to the presence of an interosseous membrane. Examples include the articulation between the radius and the ulna in the forearm and between the tibia and the fibula in the lower limb. Now that takes us to the cartilaginous joints. Cartilaginous joints are formed by either hyaline cartilage or fibrocartilage, and they are classified as primary and secondary. The primary cartilaginous joints are formed by hyaline cartilage and they are usually immovable. So we can say they are synarthrosis. An example of this joint is the joint between the epiphysis and the diaphysis in a growing long bone. Then the secondary cartilaginous joints are formed by hyaline cartilage and or fibrocartilage, and they are usually amphiarthrosis. A typical example is the pubic symphysis. Now finally we have the synovial joints. The synovial joints are freely movable joints, they are diarthrosis, and they have a joint cavity. They are the most common type of joint in the human body. A synovial joint contains a capsule that surrounds the joint cavity, a synovial fluid which is secreted by the synovial membrane, and articular cartilage covering the bone ends, allowing smooth movement and preventing direct bone-to-bone contact. Now, these joints are further categorized by structure and permitted movement. First of all, number one on the classification is the hinge joint. The hinge joint permits movement in one axis, which is flexion and extension. An example is the elbow joint and the knee joint. Next is the pivot joint. It allows uniaxial rotation. Example is the proximal radio-ulnar joint and the atlantoaxial joint in the C1 and C2. Next is the saddle joints. The saddle joints are saddle-shaped bones and they permit biaxial movement. Example is the first carpometacarpal joint, which is found in the thumb. Next is the condyloid or the ellipsoid joints. Their articulation is between the shallow depression and a rounded surface. It allows biaxial movement, deflection and extension, abduction and adduction. Examples include the metacarpophalangeal joint, which is the knuckles. Next is the ball and socket joints. Their spherical surface articulate with the concave cavity, permitting multi-axial movement, which is flexion, extension, abduction, adduction, and rotation. Examples include the hip and the shoulder joints. Next is the plane or gliding joints. They are the flat surfaces permitting limited multi-axial movement. Examples are the intertarsal joints, the intercarpal joints, and the acromioclavicular joints. So there you have it, a brief anatomy of the classification of joints found in the human body. Please don't forget to like and subscribe, and see you in the next video. Bye.